Now, one of the people who has gotten sick and is now recovering from the coronavirus is Professor John Bessler. He is the husband of U.S. Senator Amy Klobuchar. I spoke with Senator Klobuchar just a short time ago. Joining us right now, Senator Amy Klobuchar. Senator, thank you so much for joining us. How are you and how is your husband?
Well, first of all, thank you, Esme, for having me on. He is doing so much better. He is at our apartment in Washington recovering. I'm here, but I actually still can't see him except through a window and wave because they think he might still be contagious. And so I don't know when that will end. The doctors will decide. So I'm actually, Senator Smith has let me stay in her apartment. So that's where I am. And he has been through something that so many Minnesotans at least have someone in their family that has been through this. And that is that he got more sick than you would think he would have at age 52. He was coughing up blood. His oxygen went way, way low, down to like levels of 68. He had pneumonia. And so he was in the hospital about 4 or 5 days. And then he took a turn and got better. And so I just feel so fortunate. And also, it gave me this sense of helplessness of what it's like for so many people who even have it worse, who have loved ones on ventilators. They can't go see them. They're not allowed even in the hospital. And that's the right thing to do right now, and we all have to understand that, because otherwise the disease would spread more. And my husband did everything he should have. When he felt like he had a cold, he stayed in the apartment. And as a result, he didn't infect anyone, as far as we know. But the point is that it's really hard not to be with them.
And I can't imagine how difficult it must be for Abigail, your daughter, to not be able to be with him either. And that's what so many families are going through right now.
Exactly. And, you know, you want to see your grandma or your dad in the assisted living. You want to go visit someone that maybe you routinely visit and you can't do it anymore. And we have to remember it's for people's safety. That's why Governor Walz put these rules in place in Minnesota. That's what we're seeing all over the country. And one of the things that has motivated me as I keep going is thinking this could happen to anyone if it happened to my husband. And I kept making that case to my colleagues who were trying to do things that I didn't think were helpful to that legislation we just passed. And as a result of everyone working together, we were able to get a lot of money to our hospitals. We may have to give more in the future, but right now we finally were able to get some big federal funding out. The administration, as you know, on the test kits and the like, had dragged their feet for a month or so, and I think it has hurt us in our response, but I think we can come back strong now. I've been really advocating for a number of our hospitals like Fairview and Mayo that have tests that they want to get out there on their own. And Mayo's developing a test that would actually allow you to find out if you've had it before, not just do you have it now. Do you have immunities? All of that would be so helpful.
Okay. Well, Senator, I'm sure every single person listening to you, including myself, is thinking, when will this get better? When will we go back to our normal lives? Are you getting any kind of guidance from the officials that you're talking to in Washington about when this might peak?
You know, I do not agree with what the president said when he said, oh, everyone will be back in church, his words, on Easter. I don't think that's fair to say, because we know in many parts of the country, including our own, the deaths and the number of cases are on the rise. So there may be a date that we'll be able to choose, but we certainly can't choose it now. There may be a time, and I think what is much more likely is you're going to gradually see certain industries coming back with new best practices, and then you just keep testing that as you expand and allow things to open up. And I know it's frustrating, but it's the way we save lives, and it's also better for a more measured way to get our economy moving again. Because if you do it suddenly and then people start getting sick again, we're going to be back right where we were before. So you have to be really smart of following the numbers and having the tests. I cannot emphasize, as we work toward a vaccine, how important it is so people can be tested more often, so workplaces feel free to have employees come back, so customers feel free to get out there. Imagine if you knew that you had immunities, you would feel much better about participating in our economy. And that is the very test that Mayo is working on right now.
And looking forward from your family's perspective, from individual families that are fighting this fight just like your family is, what are they telling you about when your husband, John Bessler, will be able to, go and resume his life, when you can see him again, and when your daughter Abigail can see him again?
Well, I can see him through a window, so there. People have nicely dropped off things for him, and we leave him out at the door of the apartment so that he doesn't expose himself to anyone in terms of the germs, and we just don't know. So what we hope is that they'll be able to sort of say, now it's okay, because he's still coughing, and there's some mixed views of when he can be contagious, when he stops being contagious. So for now, I'm grateful for Senator Smith for letting me squat in her apartment. Basically, I've eaten her last black bean burrito, the frozen one, which I apologize if she's watching now.
All right.
You just keep going. And it allows me, actually, one thing I'll say is everyone's in their homes. I really want to get back to Minnesota, but it allows me to do some work directly here, go into my office while practicing all the careful rules we all have in place right now. You never know when we're going to be back here again, because there's going to be more bills we're going to need to pass.
Right. And that was Senator Amy Klobuchar a short time ago. We also want to let you know that the president has tweeted that he will be having a news conference today at 4 o'clock Central Time. So we will be following that as well.